righty. Good morning. Okay.
Well. Not planned, anybody.
Good morning, everyone. Good morning. I am Councilmember Kendra Brooks, and I'm so proud to serve as the minority leader for Philadelphia City Council, and I'm the chair. And as the chair of Philadelphia Reproductive Freedom Task Force. Today's resolution and hearing are the next steps in a fight that began over 3 years ago when the Supreme Court overturned Roe versus Wade. That's why we launched Philadelphia's Reproductive Freedom Task Force in this room alongside many of the people here that are speaking out today. We knew that if Trump was elected, he would use the power of the federal government to cut funding, spread disinformation, and roll back reproductive rights. We wanted to be prepared on the local level for these federal attacks, and we knew were coming. In 2023, I ran for re-election against 2 Republicans. They claimed that reproductive justice was a national issue, not a local one, and that the city didn't have a role to play in upholding reproductive rights. I disagreed with them then, and I disagree with them now. In 2024, in the budget, we secured the first ever municipal funding for the local chapter of Planned Parenthood. In the 2025 budget, we won $250K for the Abortion Liberation Fund and $200 for the SPOT, an organization that fights for period poverty in our city, providing free menstrual products. This funding was a lifetime to thousands of patients and providers during a surge in a number of people seeking care as local clinics closed and patients traveled into Pennsylvania from other states where abortion is banned. As we approached the 2026 budget last spring, local reproductive health organizations were counting on continued increased municipal funding in order to keep the doors open. But in the last budget, these organizations were defunded locally in closed-door negotiations, despite having support of my council colleagues. These cuts to city funding are happening at the same time that Trump is making good on his threats to cut federal funding. In other cities, elected leaders are taking local action to fill these gaps. Recently, Chicago awarded $2 million to their local abortion fund. Atlanta, Baltimore, Columbus, St. Louis, and others have created funds to help with travel costs and associated with seeking reproductive health care. Philadelphians overwhelmingly support reproductive freedom. Our city can and should be a leader in upholding reproductive rights, not hiding in the background. Trump is making good... Trump is making good on his promise to cut funding. We knew it was coming. We knew who would be hurt overwhelmingly: Black and brown women living in low-income neighborhoods. In City Council today, I will introduce a resolution for a hearing on the state of reproductive health care here in Philadelphia. This hearing will show the real human costs of federal and local cuts to the reproductive health care here in our city. We will also identify ways that our city can join other cities like New York, Atlanta, and Baltimore in taking stronger, more proactive stance against escalating attacks on reproductive rights. Through this task force, we will restore local funding because our rights depend on it. Thank you. Next, I would like to invite Dr. Alhambra Frary to the podium, and Dr. Frary is the Chief Medical Officer of Planned Parenthood of Southeastern Pennsylvania.
Good morning. Thank you to Councilmember Brooks and to all of the task force members working alongside her to protect sexual and reproductive health care. My name is Dr. Alhambra Frary. I am a double board certified OBGYN and complex family planning specialist. I am also the Chief Medical Officer of Planned Parenthood Southeastern Pennsylvania. In this role, I oversee administration, clinical practice, service development, quality assurance, training, and strategic collaborations, all in an effort to expand access to care. I assumed this role at Planned Parenthood at a critical time in 2023. And to say that we have been facing threats in that time really doesn't capture the moment. We are not simply facing threats. We are facing and managing very real harm. Each year, we provide care to over 20,000 Philadelphians. That care looks like birth control visits, STI testing and treatment, cancer screening, wellness visits, abortion care. And behind every number, of course, is an individual, a neighbor, a friend, a worker, a student, a parent, someone who relies on our services for essential and life-saving care. That care is very much at risk. Federal policies continue to target the very programs that our patients depend on to access care. And the stakes here in Philadelphia are especially high. Right now, we have the second highest rate of STIs of any major city in the country. We're facing a shortage of OBGYNs and family medicine providers, and community clinics like sexual and reproductive health centers and LGBTQ+ health spaces are already spread incredibly thin. Planned Parenthood plays a critical and irreplaceable role in this very fragile ecosystem. To be clear, there are not enough providers to absorb the number of patients who would lose care if our doors were to close. This is why it was so concerning that Philadelphia's budget had no funding for sexual and reproductive health care, at a time when other cities are stepping up. As Councilmember Brooks said, New York, Baltimore, Atlanta, St. Louis, they have developed funds to protect this care. By not acting locally, that means letting Philadelphians fall through the cracks. And these cuts will not be felt equally. 2/3 of our patients live below 250% of the federal poverty level. Nearly 50% identify as Black. Eliminating Planned Parenthood services means deepening long-standing inequities and pushing care further out of reach for the very communities who need it most. Day in and day out, I see the impact of this care as our patients walk through our doors knowing that they will receive compassionate, skilled, timely, and affordable care, often when no one else is available to help. Our patients and all Philadelphians deserve a city whose elected officials value their health, their rights, and their futures. So today, I'm asking Philadelphia's leaders to please follow in the example of other cities and protect sexual and reproductive health care. Invest in the 20,000 Philadelphians who rely on Planned Parenthood each year. Our city deserves nothing short of a true commitment to safe, affordable, and accessible care. Thank you.
Thank you so much, Dr. Frary. And now we'll hear from Katia Perez, Interim Executive Director for Abortion Liberation Fund of Pennsylvania.
Thank you, Council Member. Good morning, everyone. So just starting off by saying thanks to grants from previous grants from the City of Philadelphia. In recent years, the Abortion Liberation Fund of Pennsylvania has helped thousands of people access essential care, health care. People like Asia, a 21-year-old who unexpectedly became pregnant. Unfortunately, she was in a violent relationship and when her abuser learned of the pregnancy, he kicked her out of the house. Staying in her car as she worked to find a place to live, Asia was navigating getting an abortion alone. The cost was $420, and we were able to help her with $300. The clinic was able to secure the additional funds needed from national sources due to the patient's circumstances. And also people like Miranda, a 33-year-old and a single mother of a young teen and 2 toddlers. She also takes care of her mother, who is in treatment for cancer. Miranda is scraping by with only Social Security benefits as income for her whole family. After discovering an unexpected pregnancy, Miranda reached out to our helpline for support. We were able to help her with the $317 she needed to get her health care. We know abortion access remains under constant attack. That's why protecting it is a collective responsibility. Last year, Councilmember Brooks was able to secure $250,000 for the Abortion Liberation Fund of Pennsylvania. That helped us serve over 1,000 callers to our helpline, most of which are Philadelphia mothers. This year, there was no municipal funding for the Abortion Liberation Fund. The consequences of being denied access to abortion care can have long-lasting effects, from exacerbating chronic health issues to making it more difficult for parents and caretakers to financially care for their families. $300 can alter the course of someone's entire life. Local governments must step up to defend the vulnerable communities they serve when their very existence and bodily autonomy are being targeted at the federal level. It is vital for Philadelphia to continue to step up as attacks on reproductive freedom intensify. Thank you.
Thank you, Katia. Next, I would like to invite Fernando Sesto to share a few words.
Good morning, everyone. My name is Fernanda. I'm a resident of Philly, and I am a patient advocate for Planned Parenthood Southeastern Pennsylvania. The story I want to share today is not distant. It's about people, choices, and the future all of us deserve. When I was 10, my mom gave me a book about menstruation. I was very curious about my body, and she wanted me to feel prepared before I got my first period. That book was her way of helping me understand my body without shame. Soon after, in 6th grade, I went through a series of comprehensive sex education workshops at my public elementary school. They were clear, honest, and empowering. I didn't realize how important that would be until later, when I began to notice how people spoke about menstruation. In Uruguay and across much of Latin America, it's common to hear the euphemism sick or unwell when a woman is menstruating. But because of the education I had received, I had the confidence to push back. I'm not sick, periods are healthy. By 13, I began to notice something more pervasive: the unequal way society treats people when it comes to sex and pregnancy. Los hombres se van, las mujeres se quedan was a phrase I grew up hearing. It reinforced the belief that women are expected to sacrifice their goals, to stay at home, to carry responsibility, while their ambitions are treated as secondary. I saw this play out when my cousin became pregnant at 19. She had been preparing to study psychology at university, but instead of pursuing that dream, she had to put her future on hold. What stayed with me was this profound sense of unfairness, how few options she had to continue her education, to find support, and to make her own choice. Everyone deserves the freedom to decide their own future. That's why we need places like Planned Parenthood, so young people don't lose their dreams to stigma or lack of access to care. These early experiences planted a resistance in me. They felt unjust, and I wanted to understand why. I started following feminists on the news, reading philosophy, and thinking critically about pregnancy and reproductive health. I came of age in a country that became one of the first in Latin America to legalize abortion in 2012. Not only was it legal, but it was covered by universal health care. The movement's central message, abortion saves lives, stuck with me. That truth became even more personal when I was 17 and one of my best friends needed an abortion. She wasn't ready to become a parent, and she carried shame about being pregnant. Through her process, I saw firsthand how access to safe, professional care made all the difference. Not only was she saved, she was also able to continue with her life, to go to college, to find a job, to choose her own path. But I also understood that not everyone around the world has that privilege. And that's what Planned Parenthood makes possible here in Philadelphia every day. safe care, support, and the chance for people to hold on to their futures. My commitment to reproductive rights comes from caring about equality. Everyone, regardless of gender, background, or income, deserves the ability to make choices that improve their quality of life. And yet, it is women, especially women of color, and those with fewer resources, who are disproportionately affected when access is denied. The majority of PPSP's patients live on incomes under 250% of the federal poverty level. We can't ignore that cuts and lack of adequate funding put essential healthcare at risk. When resources are reduced, it's not just abortion care that it's affected. Cancer screenings, STI testing, birth control, and other life-saving services are threatened too. Abortion may be the focus of political attacks, but the impact is that entire communities lose access to basic health care. Abortion happens whether it is legal or not. The real question is whether it will be safe, accessible, and on time. Without support, thousands are left scrambling for basic reproductive health services, deepening an already urgent public health crisis. That's why I stand with Planned Parenthood, because whether it's abortion, birth control, or basic health care, control over your own body should never be a privilege, but a right. Thank you.
Thank you, Fernanda. Now we will hear from Chioma Ndubizi, Assistant Professor of Clinical Obstetrics and Gynecology at Penn Medicine.
Good morning. My name is Dr. Chioma Ndubizi. I'm a double board certified OBGYN and complex family planning specialist here in Philadelphia, and the opinions expressed today are my own. As mentioned by the speakers before me, we stand in the aftermath of the Supreme Court stripping away federal protection for abortion, compounded by federal cuts to contraception funding and a definitive path to stop Medicaid support for Planned Parenthood clinics. These aren't abstract policy shifts. They are devastating changes that reach directly into the lives of our family members, friends, and neighbors here in Philadelphia. So let me tell you what this looks like in my exam room. At least 3 to 4 times a month, I see patients of all insurance types, race, and gender identity demanding to replace their IUDs earlier than medically necessary. Why? Not because they have health issues that require a new IUD, but because they're terrified that soon they may lose insurance coverage or contraception access altogether. Their visit is as much about calming fear as it is about providing medical care. Every week, patients travel from states where abortion is banned. They often start their visit by discussing how they scrape together every dollar for travel, hotel, and care here in Philadelphia. Patients arrive not only exhausted and broke, but also at times just terrified, afraid their medical privacy may be violated. Every day, I see patients whose trust in me is shaken by online misinformation. One young woman I saw on a telehealth visit using hormonal contraception to stop heavy period bleeding and prevent life-threatening blood loss is questioning whether to continue her hormonal contraception. Not because of any side effects, but because of lies she's viewed online. Her health is stable today, but her ability to remain alert at work and active with her children hangs in the balance of what she decides after she struggles through mistrust instead of facts. These stories are not isolated. They are a snapshot of a national crisis that shows up in our local clinics. Patients aren't just seeking care, they are carrying fear, anxiety, and suspicion into every visit. And as healthcare providers, we're not only treating their medical needs, but we're also spending precious time dismantling the dread and uncertainty that decreased funding, disastrous policies, and misinformation have fueled. This is what's at stake when reproductive health is under attack. Patients making decisions out of fear instead of medical necessity. Families bankrupt by travel for care, and lives put at risk by dangerous myths. If we value health, Philly, if we value dignity, then we must act. Because patients in Philadelphia and across this country cannot afford another day of instability. Thank you.
Thank you so much. Next, I would like to invite my colleague, Councilmember Ruth Landau, to the podium.
Thank you, everyone, and thank you to our incredible speakers that we already had, and to my colleague, Minority Leader Kendra Brooks, who has done an incredible job of bringing together this task force so we can continue to focus on these topics. I'm Philadelphia's first openly LGBTQ council member, and I've been advocating for the health, wellness, and civil rights of the queer community throughout my career. It's my belief that health equity goes hand in hand with reproductive freedom. To be honest, I've been working with Planned Parenthood doing at the minimum clinic defense for decades, and also have served on the board of the Abortion Liberation Fund many years ago as well. So just wanted to make sure everybody knows that this intersection of reproductive, sexual health care did not start now and today. This has been a collaboration and an ongoing struggle and fight for many, many years, because we know that health care is a right, and it is a right for all of us. Reproductive freedom isn't just abortion access. It's not just birth control. It's gender-affirming care. It's routine, safely conducted physicals. It's the right to make choices about our own bodies outside of political interference. Queer and trans people need access to the full spectrum of health care: fertility services, abortions, comprehensive sex education, gender-affirming care, and much, much more. When reproductive freedom is challenged, who do we see hit the hardest? The lowest income folks. Immigrant communities, Black and brown families, LGBTQ families, and much more. When government fails to fund reproductive health care, it fails its obligations to help those the most in need. It fails to secure equity for the marginalized. It fails to consider the best path for our residents. And with the federal government adamantly pushing away what little progress we've made, we need our city to stand up and stand with us. I'm not just here as a council member, I'm here as a mother. Like many queer families throughout Philadelphia, you can't create a family without access to reproductive health care. LGBTQ people making their healthcare decisions today deserve to have safe, respectful, and affordable options available to them. The root of that access is funding. Without funding for groups like Planned Parenthood and the Abortion Liberation Fund, fear and misinformation are rampant. People lose healthcare access. We leave our communities unprotected. We must fill the funding gap. We must fill the funding gap. I stand strongly with my colleague, Kendra Brooks, and the entire task force to say that we must fill the funding gap now. Thank you so much for being here and for joining us in this fight. Thank you.
Thank you, Councilmember Landau. Our last speaker is a very important one. When we put together the Reproductive Freedom Task Force, I wanted to be sure that we included youth voices. Yes. Mia Santiago, who is now a senior at Central High School, stepped up to participate. Thank you so much, Mia.
Hi, good morning, everyone. I'm honored to be here. My name is Mia Santiago, and I'm a senior at Central High School. I'm speaking as a youth member today, and that is exactly what I want to highlight. When I first told my parents I would be speaking here, my father immediately asked, "Why would you? You don't know anything about that." That response reflects the stigma young people like me face every day. Too often, when people hear reproductive rights or sexual rights, they assume we're too young to understand or that the conversation is only about sex. But that is not the full picture. These rights are about health, education, and the ability to make informed decisions. They are about ensuring that when students experience their first menstrual cycles, they aren't left scared or ashamed, but supported. They are about access to real education that equips us to protect ourselves, understand consent, and know the consequences of our choices. Reproductive rights also mean the right to make decisions about our own bodies, whether that's access to birth control, safe and legal abortion, or simply the right to say no. These are not luxuries, they are necessary rights that ensure safety, dignity, and equality. And this is why youth voices matter. We are the ones living this reality right now. We see our peers struggle because they don't have access to resources. We sit in classrooms where silence replaces honest education, and we are the generation who will inherit the policies being shaped today. If decisions are being made about our bodies and our futures, then young people deserve a seat at the table. Our voices matter, our experiences matter, and our rights matter. Thank you.
Wow, I was so moved by that. Every time young people speak, it's so powerful. Thank you, Mia, for taking the charge, and thank you for joining us in these meetings. It's hard being a young person in a room with all us know-it-all adults. And I appreciate you sticking through. That completes our press conference. Are there any questions? Yes. Well, we do have people from the administration as a part of the task force. They have been very supportive within our task force meetings. Any other questions? Hey, this is not the caucus back there. It's a different one. Should we come?
Thank you.